Today I will be talking about birth control basics, a sexual health toolkit component. To start off, I will explain birth control and contraceptives. Birth control is any method used to prevent birth, whereas a contraceptive is any method used to prevent conception. These terms are both used interchangeably. For effectiveness, there is perfect use, which measures the effectiveness when a contraceptive is used exactly according to clinical guidelines, and there is typical use, which measures how effective a method is for the average person who does not always use the method correctly or consistently. Some examples of why typical use effectiveness could be lower than perfect use are forgetting to take your birth control pill, not taking your pill at the same time every day, putting the condom on incorrectly, using an expired condom or a broken condom, not replacing a NuvaRing or not correctly inserting the NuvaRing, pre-cum, not withdrawing fast enough, incorrectly tracking your fertility, or maybe having a birth control patch fall off or not get changed. There are 4 methods of birth control: behavioral methods, barrier methods, hormonal methods, and other methods. I will begin by discussing the behavioral methods: abstinence, natural family planning, fertility awareness, and withdrawal. Abstinence is refraining from any sexual activity, especially skin-to-skin contact, that may result in the transmission of disease or unintended pregnancy. Abstinence means not having outer course, which is defined as avoiding vaginal intercourse, but still enjoying other kinds of sexual activities that don't lead to pregnancy. Outer course is not abstinence. Abstinence works by preventing fertilization because you're keeping the sperm and the egg apart. With perfect use, it's 100% effective. It can also be 100% effective in the prevention of STI transmission. Abstinence can foster trust and respect between partners and does not involve hormones or a prescription from a doctor. Choosing abstinence does not have to be boring, and it doesn't mean you're not a sexual person. Making a decision to be abstinent needs to happen before the opportunity to be sexually active with a partner, and communication is important in using this method, and you need to be prepared in the event that you change your mind about being abstinent. The natural family planning and fertility awareness method is tracking a woman's fertility to either prevent or to plan pregnancy. It works by utilizing periodic abstinence on days where the woman is most fertile to prevent fertilization. It could also work by having intercourse on days where the woman is most fertile to cause fertilization. Some advantages are that no medicine or device is needed, it does not involve adding hormones, and there are no side effects. Some disadvantages are that it takes practice and knowledge of your fertility, and those who choose this method must be prepared to deal with a pregnancy because it's not always effective. The third behavioral method is withdrawal. This is withdrawing the penis from the vagina before ejaculation during sexual intercourse. It is also known as pulling out. It works by preventing fertilization by attempting to keep the sperm and the egg apart. Perfect use is 96%, but typical use is 73% because most men do not know the exact time that they're going to ejaculate, or they could have pre-ejaculatory fluid that contains sperm. Pre-ejaculatory fluid does not typically contain sperm unless there are 2 acts of ejaculation close together. The second ejaculation may have some stray sperm in the fluid. Advantages to this method are that there is no prescription or device needed, but disadvantages are that it can be disruptive to sexual pleasure, it's not effective for preventing STI transmission, and it takes communication, practice, and self-control. Barrier methods are the male condom, female condom, diaphragm, cervical cap, spermicidal foam, sponges, and film. The male condom is latex, polyurethane, or natural skin sheath that fits over the penis. It prevents fertilization by providing a barrier between the sperm and the egg. Perfect use is 98%, but typical use is 82%. Condoms can be purchased by anyone at a drugstore or in a retail store in the family planning aisle. Advantages are that there is no prescription needed. In addition to pregnancy prevention, it's also effective in preventing STI transmission, and it is one method of birth control available to men. Disadvantages are that it must be used with every act of intercourse, and you should get a new condom between every act. It could be interruptive to sex. Some might complain of lack of sensation, and it may slip or break during use. Some tips are to never double wrap condoms because it increases the chance of breaking, to use water-based lubricants with latex condoms because oil-based lubricants can damage the condom. Do not use natural skin condoms for STI prevention because pores in the material are big enough to let viruses and bacteria through. Also, some vaginal medications may break down the material of the condom, so check with your pharmacist if you're using a vaginal medication. I will now tell you about a condom study that was conducted in 2002 in a population of college men at Indiana University. It showed some possible condom use errors and problems that could increase condom failure or decrease the effectiveness of the condom. 74% of the men studied failed to check the condom for visible damage. 61% did not check the expiration date of the condom. 60% did not discuss condom use with their partner. 43% put a condom on after starting sex, and 15% removed it before sex was over. 42% reported that they wanted to use condoms, but none were available. 40% did not leave a space at the tip of the condom for the ejaculation. 35% reported slippage or breakage during sex. 30% placed the condom on upside down and flipped it over. These are just some statistics that show why there could be a decrease in effectiveness of the condom. I will now tell you about the female condom. This is a polyurethane sheath that is worn internally by a woman. It works by preventing fertilization by providing a barrier between the sperm and the egg. When perfectly used, it is 95% effective, but typically it's 79% effective. Female condoms are available online on Amazon, at CVS, Walgreens, and Kmart. There is no age limit and no prescription required to purchase female condoms. Some advantages are that you do not need a prescription. It can be used by those allergic to latex. It provides better STI protection than male condoms. It can be inserted up to 8 hours before intercourse. It can be used during a menstrual period, and it can also be used for anal sex. Some disadvantages are that you must use one every time. They can be inexpensive and not very easy to find, and it takes practice to use them correctly. You should not use a female condom at the same time with a male condom because the friction can cause breakage. With female condoms, you can use oil or water-based lubricants. The diaphragm and cervical cap are latex or silicone cup barriers that cover the cervix and are used with a spermicide. They work by preventing fertilization by providing a barrier and spermicide between the sperm and the egg. When perfectly used, they can be 94% effective, and for typical use, there's 88% effectiveness. You must see a doctor to obtain either of these, and you need to be fitted and receive a prescription. You can then get them at a pharmacy. Advantages are that both are reusable and can be inserted ahead of time, and they can be used with condoms to increase protection. Disadvantages are that they must be used every time. Effectiveness is a lot lower if you've already given birth. Both require prescriptions and fittings, and they require a lot of practice to correctly place over the cervix. Diaphragms and spermicide use may increase the chance of urinary tract infections because it increases the difficulty of emptying the bladder. Creams and gels can irritate the urethra, and insertion and removal of the diaphragm can cause irritation and infection. Spermicidal foam, sponges, and film are items containing spermicide that are placed into the vagina prior to intercourse and removed after intercourse. They work by killing the sperm before they're able to reach the egg. For perfect use, they're 82% effective, and typical use is 72% effective. Anyone can buy spermicide at a drugstore, and sometimes they're available at grocery stores or convenience stores in the family planning aisle. Advantages are that it can be used in combination with a barrier method or alone. Spermicide, foam, sponge, or film can be inserted up to 1 hour ahead of time and can be used with condoms to increase protection. They're available over the counter, they're easy to use, and they're easily reversible. Some disadvantages are that they must be applied for each act of intercourse. They take 10 to 15 minutes to dissolve and become effective, so you have to wait a little while after inserting. And they can cause possible mucosal damage to the vagina and cervix with high or prolonged exposure. They also do not provide any protection against STIs. I will now discuss the hormonal methods, which are birth control pills, the contraceptive patch, ring, shot, or implant, the hormonal intrauterine device, and emergency contraception. The birth control pill is a pill containing one or both progestin and estrogen, which are hormones that are taken every day. The pill works to prevent fertilization by thickening the cervical mucus to keep sperm and egg apart. The birth control pill may also inhibit ovulation. Perfect use is 99.7%, but typical use is 91% because someone might forget to take a pill one day, they might not take it at the same time every day, etc. For birth control pills, you must receive a prescription from a doctor, and there is no certain age that you have to be, but you need to have started your period to safely begin a hormonal method. Even though this method is very effective if used correctly and consistently every single day, it still will not be said to be 100% effective. The advantages are that it's not interruptive to intercourse, it's reversible and will provide a quick return to fertility. It can possibly remove or improve your period and PMS symptoms, and the pills become effective after 7 days, so some healthcare providers suggest waiting longer. Disadvantages are that even one missed pill will decrease effectiveness, and it has no protection against STI transmissions. Possible side effects of the pill are spotting or breakthrough bleeding, nausea, mood change or depression, change in sex drive, breast tenderness, headaches, increased acne, or body aches. Birth control pills have been studied extensively and are very safe. However, very rarely pills lead to serious problems. Here are some warning signs to watch out for. They spell out the word aches: abdominal pain, chest pain, headaches, eye problems, or severe leg pain. If you have one of these symptoms, check with your clinician as soon as possible. Contraceptive patch, Ortho Evra. It is a patch worn on a woman's abdomen, arm, shoulder, or buttocks that contains estrogen and progestin that is released. Ortho Evra is a patch that the user wears in the above places, replacing it weekly for 3 weeks. The 4th week, the user does not wear a patch. With perfect use, it can be 99.7% effective, but typical use is 91% effective because someone might forget to replace their patch, or the patch could fall off without them noticing. Both the advantages and disadvantages of the patch are very similar to the birth control pills because they're the same hormones that are being used. But one advantage that is different for the patch is that you only need to remember weekly instead of every day. Some disadvantages for the patch are that 1 to 2% of women experience the patch not sticking completely, and effectiveness decreases for women who are over 198 pounds. Contraceptive ring, NuvaRing. This is a thin, transparent ring that contains both estrogen and progestin. The ring is inserted into the vagina for a 3-week period. During this time, the hormones are released continuously at a low dose throughout the 3 weeks. These hormones prevent ovulation from occurring. During the 4th week, the woman will receive her menstrual period and will not have a ring inserted. For the ring, you must receive a prescription from a doctor. There are both advantages and disadvantages that are also very similar to the pills and the patch because of the same hormones used. The ring is used monthly rather than every day with the pill. Disadvantages are possibility of vaginal discharge and irritation, and some women dislike the insert and removal method. Contraceptive shot Depo-Provera. It is an injectable progestin-only method of birth control that lasts for 3 months at a time. It prevents fertilization by thickening the cervical mucus that acts as a barrier to sperm and inhibits implantation onto the uterine wall and may inhibit ovulation. With perfect use, it is 99.7% effective, and typical use is 94% effective. You must receive the shot from a doctor. Advantages are that there is no estrogen for women with estrogen sensitivities. It provides protection beginning the same day as injection. There is a decrease in menstrual cramps, and there's very little room for error. Disadvantages are that it requires injections. There's a slower return to fertility, ranging around 10 months, the cost of the shot, and it does not provide any STI protection. Possible side effects are after 1 year, no bleeding occurring at all. It can cause menstrual cycle changes, weight gain, mood changes, complexion changes, bone density decrease, and hair loss. Contraceptive implant, Implanon or Nexplanon. This is a progestin-only flexible plastic implant put under the skin of the arm that lasts for up to 3 years. It prevents fertilization by thickening the cervical mucus that acts as a barrier to sperm and inhibits ovulation. Perfect use is greater than 99.95% effective. A doctor must also implant this device for you. Implanon is inserted by using a minor procedure that uses a local anesthetic that takes a few minutes. It must be inserted by a healthcare provider who has completed a clinical training program. The cost of the exam, Implanon, and insertion ranges from $400 to $800. Removal costs between $75 and $150. The total cost pays for pregnancy protection that can last for 3 years. Advantages are that you can leave it in for up to 3 years. There's little room for error. It does not involve estrogen. It can be used during breastfeeding. It's not disruptive to sex. It causes fewer and lighter periods. And there's a quick return to fertility, averaging around a few days after removal. Disadvantages are that some women have heavier and longer periods or increased spotting between menstrual periods. The cost might also be a disadvantage. Intrauterine device. It is a T-shaped device inserted into the uterus that contains progestin. Progestin is released continuously at a low dose and can last for up to 5 years. The device prevents pregnancy by altering the motility of sperm to inhibit fertilization. Progestin also inhibits fertilization by inhibiting ovulation. Perfect and typical use is the same with a rate of 99.8%. A doctor must insert the IUD for you. Advantages are that you don't have to do anything other than visit the doctor, it's not disruptive to sex, and it causes lighter periods and less cramps. Disadvantages are that there is no STI protection, it can be expensive, but overall it's the most cost-effective method of birth control. Rare side effects are uterine perforation or infection of the uterus and fallopian tubes. Emergency contraception is a progestin-only pill used by a female after an act of unprotected intercourse when the initial method of contraception failed or was not used. It is most effective when used as soon as possible or between 0 and 72 hours after the intercourse. It can be taken up to 120 hours after, however, it is not as effective at this time. The FDA approved emergency contraception for over-the-counter without a prescription purchase for men and women if they are 17 or older. Dispensing policy is different from pharmacy to pharmacy. It works by delaying or preventing ovulation. It prevents fertilization by affecting tubal transport of sperm or egg. It prevents the implantation by producing changes in the lining of the uterus. This can also be known as Plan B, which is 89% effective in preventing pregnancy if used within 72 hours following the unprotected intercourse. Birth control pills are 75% effective in preventing pregnancy if used within 72 hours of the unprotected intercourse. Advantages of emergency contraception are that it can be used when a rape has occurred, when no method was used, when a method failed, or a method was used incorrectly. Disadvantages are that timing is very important, they do not provide STI protection, and it will not work if you're already pregnant. Other methods are the non-hormonal IUD and sterilization, vasectomy, tubal ligation, and transcervical sterilization. The copper T IUD is a plastic and copper T-shaped device inserted into the uterus. It can last for up to 10 years and contains no hormones. It prevents pregnancy by affecting sperm motility and inhibits implantation onto the uterine wall. The copper acts as a type of spermicide. Perfect and typical use are 99.2% effective. A doctor must also insert this device. Advantages are that you don't have to do anything other than visit your doctor, it's not disruptive to sex, it does not involve hormones, and it's very cost effective and can last for 10 to 12 years. Disadvantages are that it may make your periods heavier and cause more cramping. Also, it's expensive up front, or insertion could be painful. Sterilization vasectomy. This is permanent surgical procedure that cuts the vas deferens on the male. The vas deferens are the tubes that carry the sperm to the penis. It works because it prevents fertilization by altering the pathway of the sperm. This is only for males, and perfect and typical use is 99.9% effective. The procedure must be done by a licensed doctor or surgeon. Advantages are that it can be permanent, very effective, and your sexual functioning does not change. Disadvantages are that around 6% of males regret getting the procedure. Reversal is very difficult and not always successful. It requires doctor's appointments and a surgery. It does not provide STI protection, and very rarely the tubes could grow back together. Sterilization tubal ligation. This is a permanent surgical procedure that cuts or closes the fallopian tubes, the pathway of the egg to the uterus, also known as tube tying. It prevents fertilization by altering the pathways of the egg, and perfect and typical use is 99.997% effective. The procedure must be done by a licensed doctor or surgeon, and advantages and disadvantages are the same as for male vasectomy. And last but not least, transcervical sterilization. This is when two small coils are inserted into each fallopian tube to irritate them and cause scar tissue to grow, permanently blocking the tubes. This prevents fertilization by permanently blocking the pathway to the fallopian tubes. Perfect and typical use is also 99.997% effective. This procedure must also be done by a licensed doctor or surgeon, and advantages are that no surgery is necessary because the coils are inserted through the vagina. Disadvantages are that it takes 3 months for the scar tissue to form, it doesn't prevent against STIs, and the doctor's appointments and antibiotics are necessary. I will now explain some current research on prospective birth control methods. There are a lot of researchers looking into male contraceptive options. The first one is Vasolgel, an injectable male contraceptive that blocks the vas deferens from passing sperm for a year. This injection is reversible and has successfully undergone animal trials. Human clinical trials are set to begin at the end of this year. Genderusa, an herbal pill that blocks the enzymes needed to penetrate an ovum. It has gone through 2 clinical trials in Indonesia. Anti-epin, which is a pill with a protein that binds to epin and inhibits sperm motility, making them unable to reach an egg. They are currently doing toxicology testing before they start phase 1 of the clinical trial. Clean sheets are a pill that relax only the longitudinal muscles of the vas deferens, preventing sperm from being pushed forward. They are currently seeking funding to go through to the next phase of research for this pill. And JQ1, a drug that turns off the BRDT gene that is responsible for sperm production. This drug was initially found during a cancer study. It still needs to be isolated in order to be made into a contraceptive. For more information about types of contraception or how to get them, please visit any of the following resources: the Marion County Health Department, Bellflower Clinic, Brothers United Incorporated, CareNet Pregnancy Centers of Central Indiana, Planned Parenthood Midtown Health Center or Southside Health Center.